Just wanted to thank Diana DePaulo for La Bodega. She's catering our event. Moon Co-op, I got the coffee from them, which they have fantastic organic fair trade coffees. So if you like the coffee, visit our local Moon Co-op because it is organic foods. They try to do local, and so that's part of this movement that we're talking about is the foods we eat, and they're helping supply a lot of that food. So, and our local farmers. So part 2 of You're Not Your Diagnosis, and this will be where I will talk for 30 minutes, and then I would like Cara Badgley to come up, my new clinical coordinator, and I want her to speak for approximately 10 minutes because she's really a great speaker and very passionate about this topic as well. And she started Integrated Connections in Dayton, which is working for autism recovery. And so she's now working with my practice and bringing about a lot of neat aspects. And so I'd like to have her speak at the end of my talk in the second hour. So you're not your diagnosis, and that's the thing. What are the keys? I think it's okay for me to say, okay, you're not your diagnosis, but you're like, okay, I'm not. So what helps me not be a diagnosis? What helps me to actually get over diagnosis? And I try to keep things as simple as I can. And so try to get the big picture here in that, there's certain things we have to address. And it can get a lot more specific, and there's a lot of things I may leave out. But I want you to understand that if we can focus on at least these 5 things, we're going to make huge strides into getting better, okay? So we'll go through each of these 5, and we'll talk a little bit more about the gut, of course, because that is probably where most of the issues of disease start. And then these other things are very complementary. And actually, you can't take away one key. They're all hugely important. So the keys to gut love, and they you remove the foods that are causing problems. We want to replace things that are missing, fiber, digestive enzymes. We want to repair the gut, get it back to being healthy, and then we want to restore it. And why is it important that we help the gut? The gut is where 60 to 70% of our immune system resides, okay? When I was in medical school, believe it or not, they didn't really know what the immune system did in the gut. They were like, we're not real sure why so much lymph tissue actually is in the gut. And the reason it's there is it is processing 99.9% of our environment, okay? Your immune system is there as a sentinel to decide what's good, bad, and neutral. And so your gut is where you're exposed the most to your environment, okay? So when you eat, you process more in that one meal than your rest of your lymph tissues will process probably in a lifetime, okay? So you're making a lot of decisions from an immune point of view with your gut. And if your immune system is inflamed, guess where most of that inflammation probably starts? It probably starts in your gut. So that's why you see me in the office. I'm a repetitive, broken record. Heal your gut. Stop eating these foods. Make sure you're digesting. Make sure that your digestive enzymes work. And so when we look at that, we have to, the first step, of course, is to remove. Remove what? And so what I take my patients, I have them to remove are, of course, not only gluten and dairy, but those 2 are the biggest offending agents, okay? So if I want to heal my gut, if I don't want to be my diagnosis, I first, I use family because they can't sue me for HIPAA, but I'll tell their stories. My mom had arthritis for 40 plus years, and she had, I've just got this arthritis. I kind of have to live with it. And as I got further into functional medicine, she did something unusual. She actually listened to her son, which is usually not what happens in families. People they'll come in, and I'll tell them to do something, they'll do it. And the daughter said, I've been telling her to do that for 20 years, and she won't do it. And that's just the nature of things. But my mom actually really took what I said to heart, and she changed her diet. She removed gluten from her diet. And guess what? Her immune system, arthritis is your immune system attacking you, right? It's not a bad joint. It can be a bad joint, but it's a joint that the immune system no longer recognizes, and that's where the inflammation comes from. We calmed our immune system down, and it quit attacking that hip joint or that toe joint or the other places she was having issues. So the immune system is directly determined by the gut. The gut is directly affected by the foods we eat, and the most inflammatory food we can eat is gluten. There's a reason why I take that out of most people's diet. 95% of people feel better off of it. And there's a lot of reasons for that, and that's a whole nother lecture. And I won't go into that, but I'll tell you the first step I would tell anybody that's struggling with a diagnosis, and it doesn't matter if you're Lyme, you're autistic, you're fibromyalgia, you're diabetic, all these diseases are inflammation, and how do you control inflammation? You change your diet. Start there. Do something simple. Remove sugar. Remove dairy. All those allergies I was talking about, inflammation. Dairy is number 2 on the most wanted list, okay? It is really, some people can tolerate some cheeses, but as a whole, most people, dairy, I always say, is for baby cows. It's not really made for humans. So we don't do as well with dairy. Most of us don't, and especially when it's homogenized and pasteurized. Raw milk may be a little bit different story for some people, but when we homogenize and pasteurize it, we create all these proteins, and these are actually morphine proteins. People actually develop morphine-like proteins when they do gluten and when they do dairy, and so they crave it. They're like, I can't do without that. Well, of course not. It's like taking morphine because it actually hits the same receptors in the brain as morphine does. So, and that's not good because that lowers our natural endorphin production. And not to get too deep into the science, but when we lower our natural endorphin production, our immune system moves more so to an inflammatory state and away from a state where we fight viruses and cancer and these sort of things. So these foods are having a direct effect on us. So step 1, remove. Replace bacteria that may be missing or help support the immune system through probiotics, eating fiber, hugely important. Fiber does more for your gut than just draw water into your gut. It actually works by feeding the bacteria there, eating vegetables, eating fiber in foods. 2 apples a day, just give you a idea of the importance of apples and fiber and pectin and all these things. A whole apple, not apple juice, totally different story, but eating 2 apples a day is the same, and this is a study, showed that it is the same as 5 milligrams of prednisone a day for anti-inflammatory effect. 2 apples a day. There's some wisdom into the old sayings, okay? The apple a day thing, it's true, okay? So they're now proving that. I don't know why we need studies to prove the apple a day keeps the doctor away, but we've got it now. We know it. It changes the whole gut environment. So the more whole foods we eat, juicing is not the same as eating whole foods. Okay, juicing, it's better than nothing, and I'm not going to get into that debate, but I think whole foods, eating fruit and vegetables as they were intended is important. Okay, so there's things to be said about the body digesting things as it was meant to be. Digestive enzymes. Okay, my favorite thing now, this is what I had missed for several years in my practice when I was doing functional medicine is that if we're not absorbing nutrients, how can we heal? And glutathione is the great big detoxifier. It's the 800-pound gorilla in the body that's cleaning up all the bad things. Glutathione is made up of 3 amino acids. Well, if we're not taking protein and breaking it down, if we're eating too fast, we're not sitting down for a meal, we're not preparing our own food, we don't create digestive enzymes. And then if we don't create digestive enzymes and hydrochloric acid, then we don't absorb amino acids. And then we're not detoxing and people get sicker. And their nails don't come in and their nails are weaker, they're losing hair. And they don't have energy and they crave carbs because the only thing they can absorb without digestive enzymes is sugar. So a lot of people, this is a huge step. And I don't know why, and I'm still working on this, but why as a society we're not making hydrochloric acid in our stomach anymore. Why do we have osteoporosis when we take Nexium? Well, we've cut out our ability to make hydrochloric acid. We're not absorbing calcium anymore. We're not absorbing magnesium anymore. Why do we see increased depression when we take a proton pump inhibitor like Prilosec? Because we're no longer absorbing amino acids that make neurotransmitters. Okay, so we're supposed to make hydrochloric acid. And you know what the irony of it all is? Is that heartburn is a symptom of low stomach acid. Give me 95% of patients with heartburn. I give them stomach acid, and amazingly, the heartburn goes away. So why is it? And this is the reason I know this is because of my hillbilly cure of apple cider vinegar. I would get heartburn, and I would take apple cider vinegar, and bam, my heartburn would go away. Why would an acid make something that's supposed to be caused by more acid go away? Well, I wasn't digesting, so the food was sitting in my stomach. And so it's sitting in my stomach. There was no movement into my small intestine and so what happens when a bucket gets full? It overflows. It's only got one way to go, so it comes up. So what do? We give proton pump inhibitors, and all of a sudden the food no longer burns when it comes up. It's still coming up. We've just taken away for our ability to digest, and we've created a negative cycle because now when you try to get off of it, the brain doesn't know what to do, and it overproduces stomach acid, and my heartburn, I can't get off that. But we should have, in the first place, probably put somebody on stomach acid. Betaine, pepsin, or digestive enzymes. So without more, we need to replace. We need to fix the gut because this is the place that is the foundation. We fix the gut, and then I can build on everything else. We repair. I use things like amino acids. Glutamine is the fuel that drives the gut's healing. The small epithelial cells in the small intestine this is what they use for food. It's an amino acid. And so we can use aloe vera. We can use deglycerized licorice. We can use slippery elm. There's a lot of things we can do to heal the gut. The best thing to do for the gut is to help it heal, to repair, is to remove the offending agents. And sometimes it's more than gluten and dairy, and there's tests we can do that can prove what foods we're sensitive to. Sometimes we're sensitive to a lot of foods because our gut's been leaky, and now we're allergic to everything we eat, and we're constantly inflamed. So sometimes we have to remove a lot of foods for a short period of time so the gut can heal and we're not inflamed by everything we eat. We have to restore our gut. How do we restore our gut? Number one, take sugar out. People are always talking about, well, I've got a yeast overgrowth, blah, 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 and I crave sugar. Well, they crave sugar and they get more of yeast overgrowth. And the more yeast overgrowth, they crave sugar. So sometimes we have to break that cycle, and we do that with antifungals, both herbal and medicinal. But we have to take out the offending agents. And the processed foods are huge offending agents for keeping us from restoring our bacteria. Our bacteria, the GMOs, are interacting with our bacteria. They're assimilating. Bacteria are always exchanging DNA information. Guess what GMOs are made with? They're made with bacterial DNA. That's how they're splicing. This is proven. So we're taking a lot of bacterial DNA when we eat GMO foods, and we're splicing it with our good bacteria, and that's keeping us from having a restored gut. And the best way to restore gut is to eat organic, whole foods, okay? This is important because this is, it comes down to as simple as, are we eating enough vegetables? And it's a struggle. I know, I every day go, oh gosh, I didn't eat enough vegetables today. It's hard to remember. But a huge salad with, with tomatoes and bell peppers and broccoli and everything on it sometimes can give you your 5 to 6 servings of vegetables. Throw some chicken on it and you're done, but you have to eat whole foods. And this is what I want to take away, 99% of our immune function really is determined in the gut. If we're inflamed, and there's some exceptions to that, and I treat people with exceptions, but most of the common everyday illnesses that I run into, I heal people's guts, so much gets better. So much gets better. So you have to take care of it, or your foundation is not really set. Sleep. I'm a big advocate of sleep. And the reason I'm a big advocate of sleep is in the 1960s, we slept 8 to 9 hours. In the 1990s, 7 hours is the average. Now, because we have electronics and iPads and everything else and Facebook, we're looking at 2000, and since 2004, our average is 6 hours. And if you'll look at these statistics, as sleep decreases, metabolic syndrome, another name for prediabetes, increases 42%. Because you've changed your whole stress, adrenal, cortisol pattern. And so the higher your cortisol is, the less sleepy you are, the more sleepy you are, the higher your cortisol, the more insulin resistance you're going to get. And the risk of an MI is 4 times normal if sleep is less than 6 hours. That's why we have seen when people have sleep apnea, why I'm so passionate about sleep apnea is that you doubled your risk of death over a 20-year period if you have sleep apnea. You're double. And that's another study that's very, very telling about sleep. So if we're not sleeping, if we have sleep apnea and we're not treating it, or if we're sleeping less than 6 hours, we are asking for disease. You're asking for problems because all of a sudden your immune system, your inflammation is going to skyrocket. Let's talk about toxins in our environment. Okay, American Dental Association cannot say that mercury is toxic in our teeth. I'm not part of their organization. I'm telling you it is. Okay, it was for me. My levels were high, and I felt so much better. And I've heard too many stories. We put the most toxic substance on earth in our teeth, but yet it doesn't do anything. It does. Every time we drink something hot, it vaporizes. So our environment, our toxins, what we put in. Some people handle this well, by the way. Some people do not. And some of the people that do not are the people that are more sensitive, people with chronic fatigue, people with autism, sometimes our Lyme patients. You name a disease, and a lot of times it's the buildup of toxins. And the toxins and removing those toxins is one of the big parts of healing, okay? This is how not to be your diagnosis is to limit your amount of exposure to toxins because it plays a direct role. There's chemicals that cause the pancreas not to produce insulin. There's so much out there now. Food dyes, the things, you remember the little McCormick's, these are how I remember food dyes and the little conical things. We made Easter eggs, but we never really used it in our food that much. But now this is in everything. Everything, I saw strawberry jam with red dye number 40. Why do strawberries need to be redder? I don't understand it. And yet, we know that there's a 50% increase in ADHD, the thing that we're spending bajillions of dollars, and bajillions is a numerical number, by the way, bajillions of dollars on medicines. I mean, these are $200-300 a month medicines. This just irks me. We spend $200 to $300 a month on medicines, these special things that give us this, and kids come back down off of it and get irritable, and we're doing all this, and I look at parents and say, let's take the red dye out. That's too hard. I can't take the red dye out. They may miss out on something. So you'd rather have them on an amphetamine, which is a highly controlled drug, than change their diet. Then take out one thing, red dye. It's mind-boggling because we think food is a reward. If I do that, I'm punishing them. No, you're making them healthy. They're getting their brain back. They're not dependent on a drug. Guys, it's not that hard. We got to quit thinking of this as, I'll just take the easy way out. I will do the X medicine, and that way I don't have to think about it. I don't have to worry about, if they get, something at school, no big goldfish. They get yellow and red, all of these things, and we're not looking at the real causes. They're banned in Europe. They're banned in most industrialized countries. You won't find food with these in there because they know yellow causes cancer. There's good data on that. But why? Why doesn't it change? Because people are accepting the status quo. Why is it changing now? Why are more people coming out with no? Why is Kraft Macaroni saying we use no dyes? Because of you. You are the change. You demand it. Why does Walmart carry organic milk now? Because, and this is from one of their own press releases, because customers demanded it. The more we demand, the more we speak with our dollar, the better things become. And the same goes with medicine. The less we are our diagnosis, the more we make a change. You know, GMOs, I've spoken about that. And GMOs, we don't know what they're doing, guys. Quite honestly, it scares me. And I think it should scare all of us until we have an idea of what we're actually dealing with our own microbiome in our gut. There's 100 trillion bacteria in our gut. There's 10 trillion cells in your body. But every time you eat something from GMO, you're interacting with those bacteria. And people are fat because of those bacteria. They're skinny because of those bacteria. They're depressed because of those bacteria. They're happy because they're determining our mood. They're determining our emotions. We're actually hotels for them. They're driving the car in a lot of ways. They're deciding our immune system. They're deciding how we feel. So why are we not respecting our passengers more? When we eat GMO foods, we're sending them all kind of signals. And I don't know what those are. But I'm a little bit nervous because it's not what we've been eating for a long time. And this is new. So we need to be real careful. And I think that movement, I think we at least need to be able to make that decision. I think we at least need to be able to look and say on the label, is this GMO or not? And let me make that decision. But they're fighting that right now. And I think if we speak out on that and say, at least let me make that decision, whether I want to eat something. But the food industry is huge. And the lobbyists are important to keeping these things. So I think we have to speak out to change those things. You know, here's another toxin we don't think about. MSG makes everything good. Try to find soups or other things without MSG. You'll be hard pressed. Look at the other names for it, carrageenan. They changed the names, natural flavoring. This actually goes directly to the brain, the NMDA receptor, and causes excitation of the brain. MSG causes extreme irritability, but it's in most of our food because it's a flavor enhancer, okay? Not good. My favorite slide, I bring this one up every time, from Waterboy. I don't know if anybody else has watched it. It shows you what kind of film critic I am. It's in my top 5. But aspartame is the devil, okay? We don't know. This is a drug that actually 10% turns into formaldehyde when it's heated. You know, we know that. So with a lot of heat, we see formation of wood alcohol, and it's highly addictive. I know this. People have a harder time getting off of aspartame than they do regular sugar, and it makes you eat more. People who eat diet drinks or drink diet drinks, they actually gain more weight. So these are the toxins I'm talking about. Mold and toxins. We can talk about mold. Nobody thinks about mold. I've got one kid who's in the spectrum who we were doing great until he went and visited family, and he regressed. I mean, he regressed back 2 or 3 months previously in the healing process. And guess what? It was mold. It's a toxin. It's in about 50% of homes in America. Some people are fine. Their genetics allow them to get rid of mold. Other people do not. A lot of chronic disease is exposure to toxins in our environment, and mold's a big one. Lyme disease, Ohio is now endemic in Lyme. Don't let anybody tell you it's not here. It is. The ticks are here, and ticks, you know, Kentucky has no cases of Lyme, but ticks don't care. They're still there. Majority of my Lyme patients are coming from Kentucky. But so they don't know boundaries of states, you know. They don't stop and say, oh, this is Pennsylvania, Ohio, I'm going to stay here. We're not supposed to be over here. Or we're not supposed to go down to Kentucky because CDC says we're only in these areas. So I'm finding it, and you're not a Lyme patient. You are a patient who also may have Lyme. There's people running around with Lyme that have no clue and will live and die and be fine. Other people not so much. But this is another toxin. I think of infection as a toxin. This is another reason your immune system may not be, your bucket may not be big enough. Okay, and we'll talk about that later. Supplements. Supplements play a role. I use them a lot because most of our minerals have been farmed out of our soil. We're not able to keep up with our needs for omega-3 fatty acids. Magnesium probably is it is the number one seller. I actually contacted Pure and said, what is your number one seller? Pure Encapsulations. It's magnesium because it's probably the most needed mineral in our diets. It's in almost every enzymatic reaction we have in our body. So vitamin D, y'all have heard the drumbeat of vitamin D for a long time. It's one of the vitamins that actually has made some press, and we know now that it prevents cancer. It does colon cancer, depression, you name it. Vitamin D is hugely important. Probiotics, important. And a good multivitamin. I mean, these are the things that, we can take care of. Some things are more specific, depending on what condition we're treating, but supplements do help. You cannot take supplements, though, and expect to get well and keep doing all the other things that I mentioned before. Keep the toxins in your diet. Keep eating what you want. Not getting enough sleep. So you have to think of this as a process. It's not, I'm going to find a magic hammer. There is no magic hammer. People are like, well, I went off gluten, I didn't get better. Well, did you address your sleep? Did you address your stress? Did you address deficiencies in your diet? Deficiencies is why we would use supplements. And they're like, well, no. And I'm like, well, you have to see it as a whole. You can't pull one thing out and say, oh, that didn't work. I'm going to go back to using that again, because that's not the whole picture. And then manage stress. I mean, this has been my big revelation. One of my patients actually came in and said, I'm doing some meditation. And meditation is nothing but getting thought out of your mind. I mean, that's really what it is. You tell the brain, okay, it's all right. You don't have to process everything. It's, the brain is actually being a schizophrenic. We're all a little bit of a schizophrenic. We're always talking to ourselves. Well, I got to go over here and do that. Well, what if you go over here and do that? And if we talked out loud, we'd be put in the hospital, right? But we do this all day. We're talking to ourselves. Okay, well, that person's going to say this, and then I'm going to say this, and that person's going to... We're creating these alternate realities, and we live in them, and we get our feelings hurt, and things hadn't even happened. I mean, it's just like we are. We truly live in a schizophrenic brain. And meditation is our way to remove that and say, hey, you know what? That's not real. That's just my brain running. It's okay. I'm going to take a break from that. When we go into deep sleep, really restorative sleep, there is no thought. We don't wake up and go, oh, my God, I didn't think for 3 hours. We wake up and go, oh, my God, that was great. And so this is what meditation is. It's taking a break. Consciousness is called bringing consciousness to our well-being. And they showed a study, and this was in the New York Times, which I'd love to get my health information from, because they do a really good job of keeping up to date on some of the things that are trending. And they showed that they taught some people to meditate for 3 days. 3 days mindfulness meditation, focusing on their breath, letting thoughts come and go, but not thinking, and anytime they had a thought, letting it go. 3 days they did mindfulness versus people that were just kept quiet, told to be quiet and have some rest time. 3 months later, the people that did mindfulness meditation just for 3 days had lower blood pressure and overall better health parameters. 3 months later for 3 days of meditation. Guys, it changes everything. Our whole body, our whole energy changes so our body can heal. So manage stress is hugely important. And then finally, focus on healing. Quit focusing on being a victim, being trapped. And I want to bring up Cara because I think she's got a lot of insight into this. And I want us to hear what she has to say because I really love it when she speaks. And she brings a lot of passion, and I'll let her tell her own story. So come on up, Cara.
So my name's Cara Badgley. I joined Dr. Morris as his clinical coordinator. And just to give you a little history of my story, actually this is my 10-year anniversary this year of hearing that my son had autism. And when we finally heard that diagnosis, right, there was some relief that we finally knew what was going on, but there was also this feeling of the jail door closing, that cell door closing and locking me behind it, and with never no parole. It was like a life sentence. And autism, I feel, is kind of like this huge umbrella of all of chronic conditions. In autism, every single system in their little bodies are completely compromised to the max. And so basically they told me 10 years ago there was nothing I could do, just go home and love him and keep him safe. Well, that didn't really sit well with me. What do you mean there's nothing I can do? Right? Nothing I can do? And that was just something I couldn't accept. And so I started traveling and went all along the eastern coast of the United States to find healthcare practitioners that were beginning to acknowledge and address underlying causative factors that were creating the symptoms referred to autism. And so when I started learning about his heavy metal toxicity and his yeast overgrowth and his vitamin and mineral deficiencies and his inflammation, again, you know, you might as well just buried me in the ground and stuck a, headstone there, because I was so buried deep under the reality of how compromised his body was and how do I get out of this deep hole. And so I started learning about all of that, and I started reading about all that heavy metal toxicity and where is he getting it from, and where's the arsenic and the antimony and the aluminum and the mercury, and and I just became this crazy woman. And autism is isolating enough, but now here I'm ranting to anybody who will listen to me about all this toxicity, which made the rest of the people who hadn't already taken several steps out of my life just disappear altogether. So I received a message that really anchored in my heart pretty soon into this journey of ours of understanding how to support his body to heal, that if I continued attaching myself to those causative factors, then I was going to die. My body was under so much stress of being a single mom by that time, with 2 small boys and working and everything that goes on with life, that I was dying, taking care of him, taking care of both of them. And so I received this message, and I understood that I needed to focus on what I could do, and I needed to focus on my happiness more than I needed to focus on those causative factors. Yeah, I had those in my peripheral vision. I knew what was going on, thank goodness, even 10 years ago. 10 years ago, I was on dial-up internet. I had my first cell phone. It didn't even text message. So I realized that I needed to create this atmosphere of recovery in our home, and I did that by really finding my happiness, returning back to my joy. And I started seeing this journey of our recovery more of reclaiming our freedom and our joy than I did of fighting the yeast or trying to, excrete the metals or fight the parasites, kill the yeast, right? I stopped focusing so much on that fighting and more just embracing what I could do to support our bodies to heal, me included. When I say that we have autism, it's because whenever there's a chronic condition in the home, it's truly everyone has it, in my opinion. And so we advocate patients and their families that this is a family program. And so when I started attaching myself to finding what I could do and what I felt good about, then more things became reasonable for me to layer into our care plan. And I started understanding how our care plan was evolving and layering these different interventions to work in combination to support our whole body and our whole family to return back to happiness. And so I just want to share one quick story. I don't want to take up too much of Dr. Morse's time, but I realized my boys were growing up without hearing their mom laugh. Our home was really solemn. It was really serious. It was really depressing. And so when this message came to me that I needed to return back to joy, I started practicing laughing. And I remember the first time we were on the trampoline when I practiced laughing for the first time, both of my boys stopped and they were so scared. They looked at me. Now, granted, it probably sounded kind of psychotic at the time, right? It was so forced. But over time, I made that a priority to enter laughter back into our home. So I started watching funny movies and anything that I could do, practicing on a daily basis to laugh. And I noticed as I really attached to that joy of returning that joy into our home, everybody started getting better. And that helped me continue our journey of traveling great distances. We didn't have, any local doctor like Dr. Morris at the time who had a clue what to do. Medication and actually institution was our prognosis. And that's what they were telling me. He was so far gone and so violent and so aggressive at the age of 3, I could barely physically manage him. So I work with our patients on their care plans to take a look at the big picture, not just get so tunnel visioned into fighting the parasites, fighting the yeast, mobilizing the toxins, excreting them. I want to work with patients to understand that philosophy behind the healing. And Dr. Morse really helped me understand even the bigger picture of the care plan as I continue my own education with healing from chronic conditions. And those symptoms of the heavy metal toxicity, the leaky gut, the parasites, the candida that we're talking about today, the inflammation, it really even goes back to on a cellular level. And I love learning about how the cells really aren't communicating because they're so gunked up with all this environmental toxins in the food that we're eating. And so as we support, and this is his approach to healthcare that I admire so much, is that he's really working on a cellular level to remind the body and to give it that blueprint of how to heal itself. Because when we start supporting the cells to once again communicate, then the systems of the body start remembering what to do, and they'll start excreting those metals. They'll start taking, which then the candida improves because the metal toxicity has improved, and it's just like this chain reaction. And that goes back to the philosophy of healing, is that as we work on those cells having better communication so the body knows what to do so that it can heal itself, it kind of goes back to that family environment and remembering to also heal our communication with ourselves, like he was talking about earlier, how we have all these miniature ongoing dialogues in our mind that if we were to speak them out loud, we would sound crazy. But we really need to go back to that communication that we're saying to ourselves, those thoughts that we have. And so I had to really work, and still do, but I had to train my mind to focus on thoughts that then would create the words of healing I spoke over my boys. And I would say to them, we're doing great stuff. We're healing. We're feeling better. We're feeling happier, even though that probably wasn't really happening at the time. It was a hard go at it for many years, really just until last year. We've just really surfaced last year after 9 years of supporting his body to heal. So I'm happy to say in this 10th year, he's completely indistinguishable among his peers. He's playing football. He's getting great grades in 6th grade. He's mainstream in the classroom, like significant, miraculous healing. But the reason why that happened was because I attached more to my joy and knew that my happiness was more important than his diagnosis. And so I started watching my thoughts and had to train my mind to have these thoughts of healing, because my thoughts affected my words, and then my words created my actions, which created my habits, which created my character, which created my destiny. It's a Gandhi quote. It's been my guiding philosophy in this healing journey. So I just wanted to share that with you today, that our care plans are much more than just the supplements and the nutrition that we take. It's really the thought process and returning back to our joy. And what an opportunity. Our symptoms are telling us to stop, and that we can go a different direction. It doesn't have to be this way. And as we start healing our thoughts and our words and our actions, then our relationships also start healing, because as we begin to support the cells to communicate, we're also communicating more honestly with ourselves, with our children, with our husbands or partners or wives, and our whole dynamic of this life that we're living shifts and improves. And so in a lot of ways, I'm really thankful that autism came into my home. My nightmare has turned into my happiness, really, because I stopped fighting it. And I stopped trying to wish for my life prior to autism. That was another thing I realized was I really loved my life before autism came in my home. I had everything I wanted. Life was great. And autism just blew all that up in a heartbeat, almost overnight. And I had to stop wanting what I used to have and start really acknowledging and embracing what I had in front of me. And when I started loving that and listening to that and learning from that, miraculous changes have happened and still continue to happen. So I also just really quick wanted to share about the cost of healthcare that he's talking about. So for the past 10 years, I've spent everything out of pocket. There was 1 year I spent over $15,000 out of pocket on my son. So, thanks.
I love Cara's story. It's just so inspirational, and I think it shows that when we focus on the negative, we bring negative to us, and our thoughts are power. And Cara's journey has been nothing but inspirational because she stayed positive throughout the process. And at times, I'm sure there was times she didn't feel so positive, but she willed her way and her family's way to health. And sometimes that's what it takes, is the belief that I will get better. The people I see recover from the most devastating diseases believe they're going to get better. And sometimes it doesn't happen, even if I'm not going to say always, so people can sit there and go, well, I didn't believe enough, I'm still sick. But they will their way to seeing the bright side of things. She embraces the disease and what great things it's brought into her life instead of focusing on the negative that it could have been. And thank God her son had autism, because I got to meet her, and we're friends now, and she's helping me with my office. Thank God my son had autism, because it changed my life. And disease is not disease. Sometimes it's a wake-up call, and sometimes it's a wake-up call for a whole family, which it's been for mine, and it's changed thousands of lives, I would hope, because I've changed, and I was able to take that to my patients. So we don't always understand things that happen to us physically, but if it's all our perspective and how we approach it, and that can be the most powerful thing that we can bring to not being a diagnosis. So we'll take another break, and we'll be back in 20 minutes and have a short session, and then I'll answer questions. Thank you.